case, a stroke.
Can you please count from 1 to 10?
Every minute of Linda Lumbro's daily life is a frustrating struggle. She suffered a stroke 3 years ago, which left this teacher barely able to walk or talk.
4, 5.
What can you tell me, Rick, about strokes? How common are they?
They're very common. In developed countries, a stroke probably happens every 10 minutes. We know that it's one of the biggest killers. It kills more people than breast cancer and prostate cancer. Essentially, a stroke is something that goes wrong in your brain. It can either be a clot that blocks off blood supply, or it can be a bleed, so that you lose oxygen and nutrients to that part of your brain and the cells start to die. So it can have profound effects. It can have temporary effects or long-term permanent effects.
Doctors have told her that this is how she will be forever. That's why Linda's travelled to this Florida clinic to try a new controversial treatment.
I can understand why the speech makes it very frustrating.
It's her last shot. One injection of a drug called etanercept into her spinal cord at the back of the neck.
What's different?
A brief few minutes pass to let the drug flow to her brain.
Clear.
Clear. Okay.
And not even Linda or the doctors expect what happens next.
Okay, did it look cloudy? Okay, now it's clear.
Oh my.
It was a bullseye hit on the pathology that was interfering with her brain function.
Yeah, you're doing fine. You're doing super.
Using etanercept in this way on stroke patients is groundbreaking.
So crisp.
1, 2.
The conventional and approved use of etanercept is actually for the treatment of severe arthritis.
Can you bring it up?
But Dr. Ed Tobenik has 700 patients who've received this treatment at his Florida clinic. An anti-inflammatory, it attacks or blocks the build-up in the brain of a molecule called TNF, or tumour necrosis factor.
In stroke, what happens is there's an inflammatory response, a chronic inflammatory response that is caused by the stroke. Etanercept works by neutralizing that chemical TNF, thereby improving the ability of brain areas to communicate with each other.
Dr. Tobenik now claims his unorthodox treatment can aid stroke recovery.
Okay, a little stick just for a second.
We see improvements in cognition. We see improvements in motor function. We see improvements in spasticity. We see improvements in pain.
617 stroke patients.
It's those improvements that 52-year-old Linda and her husband Benny have been searching for.
How would you describe your wife before this happened?
Oh, very outgoing, people person. Loved to chat with people and visit and, help people also.
Linda collapsed while teaching in her classroom. It was a massive stroke following an epileptic seizure. She lost virtually all speech, and Linda's left side fell limp and numb.
Touch your nose.
Traditional stroke therapy could only do so much, and after 6 months in rehabilitation, Linda was sent home.
Are there warning signs that we should keep an eye out for?
Yes, if you're worried someone you're sitting next to is having a stroke, we talk about the FAST test. face, arms, speech, and time. So the first thing you might notice is a drooping of the mouth. They may not be able to speak properly, or at least understand speech. It might become slurred. Their strength, they might just describe a weakness on one side of their body. And time, of course, it's crucial that something's done about it as quickly as possible, because there are treatments that we can get onto and lessen the effects of a stroke.
When she first came home, she couldn't even do stairs, struggled to do bathing, very difficult time. And she always was very independent, and it was hard. It was like a shock almost. You know, we thought, you know, she's gonna get better, progressively better, and as time goes on, and yeah, a little bit, but not really what I thought as time went on. So it's like, well, maybe this is the way it's gonna be, and we need to learn how to deal with this.
It's hard to watch your mother not know who she is anymore, because she was a mom and she was a teacher, and then when that's gone, she's trying,
a different person.
Yeah, she's trying to find her place.
Do you want to take this by hand or put it in the bag?
No, take it on board. Like Linda, Antoinette Papa from Brisbane, Australia, knows the pain and suffering of a stroke.
You right there, baby?
Yeah,
With husband Carlo, she's making the long journey to America for an appointment with Dr. Tobenek.
There's all the ducks out to say goodbye.
For 12 years, she's lived with paralysis and constant pain, and she's been searching for any treatment that might help. Now she's willing to try the etanercept spinal injection.
We have talked about it a lot. We'd be happy between 5 and 10% improvement.
For me, if I could get rid of some of this tightness in my arm, that would make a huge difference. Because it's not just sort of makes things difficult, but it's also quite painful. Having the stretches is very painful, so it's not a pleasant thing, and it's a very hard condition to treat with anything else.
The etanercept injection will not reverse paralysis in stroke patients like Antoinette, but Dr. Tobenek believes it can decrease severe muscle spasticity and ease post-stroke pain.
No?
The shoulder pain, is that something you have every day?
Yeah, just about every day, yeah.
But if I try to move your wrist up, is that uncomfortable?
Yes, it is, yeah.
Just a little motion is uncomfortable, okay.
It's really taxing. Antoinette is somewhat of a guinea pig. She'll be the clinic's very first stroke patient to undergo a sophisticated 3D brain scan following the injection to see how blood flow and activity is affected or improved by the drug.
When there's a red area like we see, that indicates a more than 3.5 times standard deviations improvement in blood flow in that area, and that's quite spectacular.
Before the etanercept treatment, her brain looked like this. One day later, there are 6 red spots on the scan. They indicate new activity in the brain. Blood flow appears to have returned to areas previously affected by her stroke.
I think that what we're seeing represents a transformation from what's called a stun brain, where the brain cells are actually essentially hibernating, they're not able to communicate, to a state where the brain cells in these areas have woken up.
Later, Antoinette says she can feel what the scan shows.
You have less pain now than you did before?
Importantly for her, more flexibility in her paralysed side and significantly less pain.
Not that bad.
No. 162 degrees with a pain of 6. Now we're at 170 with a pain of 0.
Wow. That's amazing. It really is amazing. You know, it's like in a couple of days to have increased by that much without having to do a whole lot of physical exercise to get there. It's just incredible.
Any pain? 0 to 10?
About a 1. Well, that pain is a big one. The increased mobility and the fact that my arm is so much looser is fantastic.
It's only been a brief few minutes since Linda received that injection of etanercept at the base of her brain.
Clear. Okay.
She's been tipped upside down to allow the medicine to flow into her brain. So, remember this? This is stroke-affected Linda just before the injection. Moments after the shot, she sits up. The change in Linda is frankly amazing.
It's gone. Hi.
Hello there.
Woo-hoo! It worked. On me.
Yeah.
Oh. In here is here. Hi. It's me.
It's truly a miracle. It happens all so quickly, and it's done. And before you know it, it's all over with, and then boom.
I can talk. I can walk.
We felt it was likely that she would improve. To improve almost back to normal was just spectacular and wonderful and gratifying and very, very moving to watch.
Hi.
It's just truly amazing. The change is absolutely miraculous. It's amazing. Every day there seems to be something. I said, oh, I can do that now. It's amazing.
Back at home with her family, Linda is full of life.
Maple Sunday? Maine Maple Sunday on Sunday. Elizabeth Brown entered the world skinny, nearsighted, and shy.
It's hard to believe the simple joy of reading to her grandchildren was impossible just 8 weeks before.
Well, if you saw what I was looking at, you'd be like, that's a cool berry eating duck.
I described it like, if you think of your mind as like a window, and the window is always dirty. It's got this film, filthy film on it, and no matter how hard you scrub, it will not go away. That was my mind, and I literally would see words, and then if you could get the words in an order that would make some sense, then to try to get those words to actually come out of your mouth correctly, that didn't work well either.
Sissy got on the phone, she goes, "Mammy, you sound funny." Because she was used to Mammy the
Can you talk to Mammy? Can you talk to Mammy?
It's amazing and humbling and something that you can't describe when your mother leaves and she can't pick up your newborn son, and then she comes home and she can.
Huh?
And now she changes to be person and babysits and, here you go, Mom. Just is mind-blowing and there's no words. Besides that, it's an amazing miracle that so many people should be able to experience.
Linda's almost total recovery from the stroke is just astounding.
I didn't think I'd be completely me. I really didn't think it would be as profound as it actually turned out to be. But I thought, if I could just have my speech back, because I want to be able to think and and speak correctly. And if I can't have the physical part back, that's okay. I can deal with that. But to get it all back, it's truly a miracle.
Still uncomfortable if we touch it?
She's telling me to shut up.
Dr. Tobinick acknowledges
Said
it
shut
won't
up
work
before I
for
beat you.
everyone.
And she called
Only
me.
another few minutes.
He says 1 in 5 show no significant response.
How usual is this kind of radical
Well, this
treatment?
one's much more controversial because this one's not stood the test of time. There have been no randomised controlled tests that say this will work for most people. So it's very much out there in the research stages. We're talking about injecting things into places that may have an effect. So tried and tested neurologists might argue that this is still very much a watch and see thing. But for this particular person, worked like a treat.
Cute, faster, and stay.
But hundreds of his patients, like Linda, are quick to answer the critics.
I remember how to read.
I don't get it, because have they viewed any of the people who have agreed to be taped when they've received the treatment? Have they read anything? Have they talked to any of us? I would tell them to take a look at me. How much more proof do you need? They think it seems too good to be true, sounds too good to be true. But if you just look, there's no denying it.
We don't know if the effect will be permanent because we only have several years of experience. I think it's reasonable to think that it could be long-lasting based on what we've seen with other patients.
Dr. Tobinick is pushing ahead with his own science and evidence to back his work, like mapping the brain to see where the etanercept flows and how or why it seems to improve brain function.
Like, life's back, and I'm ready. Like you say, that light, all that fog's gone. You can think, you can talk, and all that numbness, your mobility, you've got everything, it's all back, so you've got all this time to make up for.